Good afternoon, everyone. I'm so glad they're able to join us today. My name is Tori Hughes Adamson, and I am the outreach specialist here at Tools for Life in Georgia. And again, we're so excited to have you on today for our webinar looking at assistive technology to improve health literacy. Just a couple of housekeeping tips to ensure that we are all on the same page. This is being recorded for future viewing for anyone who would like to share this with other colleagues or those who were not able to join us at the time. And this will be available for a year. Excuse me, let me restart that. We are offering credits for 1 year for this webinar. Those are CEUs and CRCs. Should you wish to receive those, please get in touch with us and we'll get you the proper information. We do have live captions as well for this webinar. Our wonderful captionist, Heather, is with us today, and you can view the captions using the Zoom toolbar, or you can go to a stream text link, which I've put in the webinar chat. One thing about the chat is that it is only available to view for attendees. You will not be able to type any comments or anything like that. However, there is a Q&A button that you're welcome to submit questions into, and we will answer them as they come up. And on that note, I am going to pass it over to our presenters to introduce themselves. And I will turn my microphone off, but I'm here if you need me, so take it away.
Hey everybody, I'm Sal Kibler and I'm a gerontologist here with the Direct Services Group at Tools for Life. So while we work with people of all ages with disabilities, my work primarily focuses on those who are older adults. Martha?
Yes, good afternoon, everyone. Just want to thank you all so much for joining us today on this webinar. I am really just here to support Sal. You guys are in for a really great treat. I looked at this PowerPoint and I've been working with Sal on this topic for a while. So again, we just thank you all for being here today.
So today we're going to learn about a couple of different things you may know a little bit about, but it's not something we talk about a whole lot. First of all, to define health literacy and understand the implications for older adults and really the implications for all people. Name 3 items of assistive technology that can help improve health literacy, and identify barriers to healthcare and learn strategies for making public health information more accessible. Next. So before we start that, I just wanted to mention the American Rescue Plan Act, ARPA, and that is what the funding that we've used to develop presentations, to do research, to buy some special pieces of assistive technology for our lab here at Georgia Tech. And it was really funding that was given to the Assistive Technology Act programs around the country to help improve and prepare us for future public health emergencies, coming out of COVID and realizing that perhaps we were not prepared, and how can we be better prepared in the future, and to increase health literacy among persons with disabilities and their families. So let's start out with a few definitions. First of all, what is Tools for Life and what is assistive technology? Tools for Life is Georgia's Assistive Technology Act program. There's one in every state, and we provide Georgians of all ages and disabilities the opportunity to gain access and acquisition of assistive technology devices and services so they can live, learn, work, and play independently in the communities of their choice. Basically, we are here to help them find ways to be more independent, and we think it's just as important that they are independent in their recreational life as it is their work life. So what is assistive technology, or often you'll hear it called AT? So it's really any item or piece of equipment that can be used to increase, maintain, or improve functional capabilities of individuals. And you see here to the right, this is someone who's working on a special keyboard that has large, high contrast letters perhaps someone with a vision issue. Sometimes these have Braille on them. We have a lot of keyboards here in our labs at Georgia Tech that can be used by people that can't sit up, that are in a hospital bed. So any kind of assistive technology. And I think if you look around you right now, even on your body, you probably have a phone, a smartphone, a smartwatch. Maybe you wear eyeglasses. Maybe you wear hearing aids. Maybe you use closed captioning at home. Maybe you use GPS. So assistive technology really makes life convenient for most of us, but for people with disabilities, it makes life possible. This whole AT Act program comes out of guiding principle in public law that says disability is a natural part of the human experience and in no way diminishes the right of individuals to live independently, to make their own choices, to go to school, to pursue meaningful careers, and be fully included in the fabric of our lives. And so this is very important for us as we look at trying to help people with the services that we provide. We also live here at Georgia Tech in the College of Design and are part of something called the Center for Inclusive Design and Innovation, sometimes called CIDI. And they do a whole lot of services and really high-level research in the world of accessibility. So they focus on accessible education and workplace. Down there, they also do, I say down there because a lot of them live in the basement. The Braille production folks do captioning and described media, digital accessibility, e-text, which is helping people be able to read who have vision challenges, and all kinds of assistive technology services. So we're really lucky that we're here with these folks doing this kind of work, and they're lucky to have us because we can partner and help each other to create a better world for all of us. So we've already gone over this. This is important that you realize that you probably have a lot of assistive technology you use, even if you're not disabled. And also persons with disabilities, all of us will probably be a person with a disability at some point in our life. Our core services here are, we provide a lot of information and assistance. People call us and ask us for help in reconfiguring some of their public spaces. We do a lot of assistive technology demonstrations and equipment lending. We have over 10,000 pieces of assistive technology in our lab here. And we do a lot of training to groups. This would be one of those trainings. We also have funding, education and solutions. We work with a partner on that. So if this piece of assistive technology is something that somebody needs to find a way to pay for, then we help them work on that. We also work on AT reuse so that folks, when they're finished with the AT, can pass it on to somebody else who might be able to use it. Assistive technology addresses functional needs. So it's the things that you might imagine when you think about persons with disabilities. It might be someone who has vision or hearing or speech communications issues. It might be learning, as in learning disabilities, or cognition or developmental. It might even be mobility or seating and positioning, daily living, computers, recreation, sports and leisure, almost anything. You'd be surprised at some of the pieces of assistive technology we have here. So I would encourage you that if you have an issue or if you want to work with somebody and help improve their lives, you give us a call or call your local AT Act program. There's one in every single state. So we have a statewide network. Georgia's a very big state with a lot of counties. So in order to reach out to other people, we have folks that we are partnered with in assistive technology resource centers, outreach centers, the Centers for Independent Living, the area agencies on aging, and the Aging and Disability Resource Centers. And in Atlanta, one of our major partners is also FODAC, which is Friends of Disabled Adults and Children. And I would recommend that if you don't know FODAC to do some research on them. They have warehouses, literally warehouses and warehouses of all kinds of assistive technology that can sometimes be gotten for free or for a very small amount of money. So demonstrations, we do this free of charge. You come in or you call us or we get on a video call with you and we talk to you about what might work best for you and assist you in making informed choices. We want the person who's going to use it to be part of that conversation if they can be. We want to find out what that life is like that that person lives. What do they do? Do they work? Are they at home? Do they take the bus? What kind of services that they maybe already get, and learn about those devices. So we make recommendations to folks based on the information that we take in that day, and also our expert team of speech and language pathologist, occupational therapist, a gerontologist, assistive technology specialist, a vision specialist, and a master's degree in public health. So you are really getting high level brains working on your behalf when you make a phone call in. So when you come in or when we talk to you over the phone, we might recommend to you any number of items. I'm going to go through some specific things in a minute, but it's really easy. What we do is we will lend them to you for about 6 weeks. When you get them, we will give you a return label to mail them back to us. Sometimes people come and pick them up. Sometimes we ship them. Sometimes we drive and meet them someplace. But the point is we are as easy as Amazon to work with as far as returning things. So it's important to us that we have some time to train you on those. We can do that over the phone or through a video chat, and to make sure that you're using them right. And if they didn't work for you, to work with you to try to find another solution. We also have a very strong commitment here to older adults at Tools for Life. We have a gerontologist on staff. We have a lot of a really great relationship with the Georgia State University Gerontology Center. We've had interns from there. We have labs that focus on devices that assist someone who wants to age in place. We have a lot of items related to dementia and memory loss. We work on something called the Access to Aging Well grant and a health literacy grant. And we interact with local programs and businesses in aging. And we are a member of something called the Commit to Connect Social Isolation Coalition, which came out of the extreme social isolation and the ensuing health issues that came after COVID. So what is health literacy and why does it matter? It's really super important. So it's really the ability, if you go on the internet, you'll find about 25 different definitions, but these are my favorites. It's the ability of a person to obtain, understand, and access healthcare in order to make appropriate health decisions. In simple language, health literacy is you being able to understand and to take the right action to make good health decisions. And why does that matter? It matters because 1/2 of US adults have low health literacy. You probably know somebody. 2/3 of older adults do not understand basic health information, and patients with low health literacy cost 4 times as much as patients with high health literacy. So there is definitely a proven correlation between low health literacy and poor health outcomes. And reason why is really when you think about health literacy, there are a lot of components that go into being health literate. You need reading as part of that, and writing, being able to hear, numeracy, in other words, working with numbers because of prescriptions and taking things 2 times a day or 3 times a day. Today, digital proficiency is really important, and cognition. So it seems like it should be an easy thing to be health literate, but in fact, it has a lot of complicated inputs to it. So we learned some things from the pandemic. And first thing we learned was that masks can be scary and make communication very difficult for people. We learned that many healthcare websites and printed materials are difficult to read and navigate. Tools for Life actually did a lot of work with the CDC to help make some of their COVID information more friendly, more easy to read for people with disabilities of all types. Vision and hearing limitations lead to misinformation and misinformation. As you can imagine, if you are listening to your doctor or your nurse tell you something and you're not hearing it, then you're missing a big part of it. And also, it leads to the caregiver, family or otherwise, sometimes taking over for you, which isn't always the best idea. It's important for you to take responsibility for your health literacy when you can. We also found out that with appropriate motivation, non-digital people can learn to become digital, and older people are part of that. Once they were motivated and understood they could do a Zoom call with their grandchildren, or they could go to Easter services in the year 2020, they started using a lot of video services a lot more often. And that's great because it also led to telemedicine. And what happened with telemedicine is not only did the insurance companies catch on to why that's a good idea, but also the doctors felt like they could give quality care remotely. And there were also a lot of remote monitoring, and home tests became common. Probably the most famous is the COVID test, which to our way of thinking were pretty illegible and counterintuitive and hard to use. So what can we do about some of these things? Well, first of all, there are friendlier masks. And in the future, if this happens, or anyone who needs to wear a mask, we hope will consider looking at it a little bit differently and showing their face. It helps people who can't hear well understand better. It can help people with low cognition or mental health issues be less fearful. We love that these people over on the right-hand side of this picture all have a picture of themselves as normal human beings, so that they can just be friendlier and ease the tension and anxiety that goes with being in a hospital. Also, health communication basics are things that we are working with here all the time. And one of those is to make sure that your website, meaning your doctor's website, is published information, is written and developed in the most accessible way, simple language, no abbreviations, fewer steps, larger type, have a sign language option, and screen readers. Be able to make sure you have it cleared so that screen readers, for people who cannot read, can run it through their screen readers and have it read to them. Also, we suggest stocking communications boards for those who are unable to talk. I'm going to show you one of those in a minute, but people can actually point to different things on the communication board. If they're on a respirator, as many people were during COVID, they can communicate better with their doctors and also with their families. And then things like pocket talkers, which are small amplifiers that we have here in our lab, that we are recommending for people who have limited hearing. Maybe they don't have or won't have hearing aids, but if with the pocket talker amplifier, maybe they can understand their nurse and their doctor better. Communications aids. These are pictures of the two that we were mentioning. One to the right is the pocket talker, and the one on the left-hand side is a communications aid, but there's also one that has more healthcare information on it. So any of those kinds of things both of these are super reasonable in pricing. The communications aid is just something you print and laminate yourself. Pocket talker is probably $65. Also, visual challenges are common, especially among older people, but that means that you should test all of your visuals for accessibility. And that means everything that you get, test results, going home orders, prescriptions, those all need to be written in a way that you can understand and you can take action and be health literate in the end. Also, some apps can be helpful as visual aids. And wherever you go, there should always be a hard copy option. And if you go someplace and they say, will you please fill this out on your phone? And you don't feel comfortable doing that, as I don't feel comfortable filling things out on my phone. And my fine motor skills are not that great. And I always ask for a hard copy option. They may frown at you maybe the first time when you ask, but ask again. It is something that they are required to have, and they should have for everyone. So this on the right-hand side shows you this healthcare communication board. As you can see on the left-hand side is the pain rating that we see a lot in doctors' offices, and also a body pain locator. So there's a human body there that you can point to and say this hurts or this hurts, and then different body parts. And we really would recommend that public health individuals and doctors get down on the level of the person that they are talking to, if they're in a wheelchair or if they're in a chair. And so you can look them in the eye when you're talking. They're going to be able to understand you better if they can see your mouth moving. Even if they have a caregiver with them, it's really the right and polite thing to do is to speak directly to the patient unless that's not working. Use easy visuals to help explain your point and help those hard of hearing, as you can see on this chart on the right. Particularly with older people, people sometimes use words like dearie and honey, and I think they are intended to be sweet, but in many cases they can be kind of demeaning or almost like baby talk when you're talking to older people. So be careful about that. Sometimes it's hard to do because I think we just naturally defer to some of those things. And be culturally sensitive. Have materials translated as necessary. Obviously, we have so many people now who have or are proficient in different languages than just English. And so trying to have some kind of materials translated as necessary. And you can ask for that in advance to try to have that help you. Because if they don't know, they may not be prepared. Improving web accessibility is crucial for improving access to health information. So we are very big on using captions. We use captions for everything we do. You have that opportunity to be using captions right now. I use captions at home when I watch television. You can even use captions. I just discovered when you go to the Fox Theater and see a play, you can put it on your phone and they will give you the captions as well as the amplifier. Color contrast helps with people being able to see things, and also the navigation on keyboards for assistive technology. And we have a lot of keyboards, as I said, a lot of different possibilities. So you can see that people who may have very limited ability to even use their arms can still use computers, can still use their phone to see things with good contrast and large type, and also use some of the products that we have that are voice recognition. Also, healthcare without leaving at home. Wow, COVID really showed us that that is a thing and it can be done. So individuals use telehealth opportunities when trained properly and when one click can get you there. One of the beautiful things about Zoom and some of the other video meeting services is that it isn't very hard. You go to launch meeting and you're there. So be thinking about that and trying to keep it from having too many gatekeepers and too many passwords and special codes and that kind of stuff. The assent of home test and home monitoring devices were accepted, and it gives an opportunity for all providers to ensure that their portals and their communications devices are written in simple language, legible fonts, and are screen reader friendly. So over here on the right-hand side, we have a number of different things. The one on the far right is the oximeter, which you can buy and have at home. You can also, I have one of these blood pressure cuffs. I take my blood pressure every day and it goes to my doctor, and it was paid for by Medicare. So it's a great way. What I found with it is it was very motivating to me to get my blood pressure down when I started looking at it every day. Before that, it was just something that when I went to the doctor, I saw and I didn't take very seriously. There are plenty of watches now out there, smart watches that do all kinds of things. And so lots of different opportunities for you to have things at home and that can help you not have to go to the doctor regularly and be more regular in your checking of vital signs. Medications. Wow, we got a lot of those. We have here in our offices something called the Hero. That's the one over here. The large gray machine. It almost looks like you fill that with the prescriptions that you need, and you actually are going to program it to put them down in the bottom into a little pill box, a little pill cup rather, when it is time for you to take them. It's connected to by Wi-Fi through a phone. And so with the phone, you or your caregiver can see if you did get your medicine. This is a subscription, as are many of the things now that have to do with the phone. So you need to look at the cost of things like that. But it is pretty, does everything but make you swallow it, is what I'd like to say. And then over here on the left-hand side is one that's somewhat similar, not quite as complicated. And you load your pills in, and it has an alarm that goes off and tells you when to take them. They dispense, they send alerts and notifications, and they can also deal with auto refill. So there are a lot of PDAs, or personal digital assistants. This one on the right here is the Alexa Show. She's great because you don't have to know how to use a keyboard or a computer to use her. You can walk in the morning and say, "Good morning, Alexa," and she can be programmed to say, "Good morning, Sal. Today is May, what is it today? 30th. These are your appointments," or you can ask it for your favorite recipe. It can read the front page of the newspaper to you, or other things. So it really gives you an opportunity to connect with your doctor's office, to call 911, to research health conditions, and to schedule medication reminders. So there are a lot of these, but we're finding that they are pretty popular with older adults particularly. Smartphones. There are so many things on your smartphone, and I would suggest that you maybe spend some time with it, and also with, if you have a watch. There are lots of apps that can help you or your loved one in many ways. Vision wise, there are apps that will actually read aloud things to you, that will magnify things for you. You can actually set up a different contrast on your phone that might work better for you. It will give you, sometimes there's audio description. I use something sometimes called Seeing AI, and I can put that on a menu. It'll read to me. I can put it on a dollar bill. It'll say it's a dollar bill. I can take a picture of someone who's in my office, and it will describe that person to me, including their age and gender. Hearing, you can get captions for things. Your headphones and hearing aids. My hearing aids are run through my the Wi-Fi into my phone, and I can turn. So now when I watch TV, I don't need it as loud as I once did, but my husband does. So I can turn down my hearing aids, and he can have the sound higher. Also, there's sound recognition on these. So sometimes somebody perhaps who has hearing issues but is babysitting, maybe might not hear a baby in the other room. You can actually program that to hear the baby, or to hear a dog barking, for instance. And so these are all things that you can do with just your phone. There's also a lot of voice control and keyboard shortcuts you can learn. So I would suggest, if nothing else, go to your accessibility area in your telephone and kind of play around there. I'd also suggest you look at a couple of apps. MetaSafe is the one I use to set up my pill boxes. There's also Seeing AI, as I said earlier. There are lots of different opportunities. The Gala is the one I've used at the theater to be able to hear things. So there are lots of different opportunities with your smartphone, and you just need to really spend a little time with it. Also with your television, you can have captioning, and you can slow down some of the dialogue, which I really appreciate, because sometimes they're talking so fast, it doesn't matter if I can hear them or not, I still can't understand. Next slide, please. Oh, here's the ones I was just going to tell you about. So Seeing AI, Be My Eyes, Rewordify, phone captioning, and remote interpretation systems services. So if you are in a meeting and you need someone to interpret for you, then you can actually use your phone for that. Pretty exciting. And then Health IQ is an app that CDC has. I think a lot of people have MyFitnessPal that will track your activity. There's also the activity tracker that comes with the phone and also with the watch. And your watch now can can monitor your heart rate, your blood pressure, and even your oxygen, not quite as thoroughly as it would be in a doctor's office, but lots of opportunities there to be more conscious of what's actually happening with your body. And there's one called Complete Anatomy. I think there's a lot of discussion with doctors and nurses and healthcare in general about anatomical words that people do not understand. Complete Anatomy can be a place for you to go and maybe do a little research. And then My Magnifier, you can put that on your phone. You can also put that on your tablet. So your tablet can just go over like a page of a magazine or a newspaper or a textbook, and it can magnify for you.
Sal, we have a question in the chat asking if there is a charge for the apps.
Many of these apps are free, and some of them do have cost mostly low. I would say the place that you have to really figure it out in advance is anything that is a subscription that runs through your phone. Anything that uses Wi-Fi is generally going to have either a subscription attached to it, or is going to be a product like a hearing aid that you've already spent some real money on.
Okay.
Yeah, so there's not, I know that Seeing AI is free. I know MediSafe, which is the one I use for my prescriptions, is free. And certainly Health IQ from CDC is free.
Okay. We do have someone who has their hand raised. If you don't mind putting your question in the Q&A, that'd be very helpful. Our attendees do not have microphone rights. So if you have any other questions, please feel free to put them in the chat, and in the question and answer. We've got plenty of time to answer your questions. So please continue to put them in the Q&A.
Okay. So we have a website that we would love for y'all to visit. In fact, we're right in the process of updating it. So in the next month, make sure you go visit. It will have a lot of really great information for you about what we do and about the different areas and the different labs that we have here, and is also a place where you can communicate with us if you need to, if you want to set up an appointment, or you can call our numbers, which I believe are on the next slide, maybe. Yes. So feel free to call our numbers. As I said, it's very easy to deal with us. You just take the phone call. And we have a customer service person who will then assign one of us to it, and we will get back in touch with you and see what you're thinking and what your needs are. We will then collaborate as a team as is appropriate, depending on kind of the area of need, and get back with you and make our recommendations. As I said before, we love doing it in person. We love having people come see our lab. And also, but we realize that's not always feasible. And as we said before, the video meeting services are pretty great now, and we can do a lot of those things on the phone. We would encourage you to follow us on our social on Facebook, Instagram, and Twitter. And CIDI also has its own social media sites. Any questions?
Thanks so much, Sal. We do have someone who has asked a question, and the question is, do any of the state tech programs do in-home visits for people who can't get out to a demo center?
I'm going to let Martha answer that one.
Yes, that is a great question, and it would vary to state. So depending on what state that you are in is they would let you know if they were able to do that. In Georgia, we really have not done in-home since COVID. We do try to meet people if it's a library or if it's a center for independent living or a public place close to where they live. We can definitely try to do that, or we will work with the individual to see what works best. If you are not in the state of Georgia, you can definitely reach out to us so we can put you in touch with your assistive technology program in your state.
And Martha, what is the site? I should have put that in the site where people can find their local assistive technology.
Yeah, it is the at3center.net. So let me see if I can pull that up, and I'll put that, or Tori, would you be able to put that in the chat box for us? Hey, yes. Thank you, Tori. You're on the ball. at3center.net.
We've still got plenty of time for any more questions, but Sal, I know that you want to talk about the health literacy survey.
Yes. So part of what we're doing with this health literacy grant is trying to gather insights about health literacy and assistive technology from people with disabilities and older adults. We will use this information to help hopefully improve access to healthcare and health information. And we would greatly appreciate it if you would take this survey or pass it on to someone you think might be appropriate. We have a QR code right here and a link, and we are very interested in hearing what you have to say about this.
Thank you, Sal, so much. Yes, we definitely have time for questions, but also just wanted to reiterate that the items that we talked about, that you talked about, Sal talked about today in the webinar, we have those in our lending library. So if there's anything you'd like to try out, our loans again are for about 6 weeks to make sure they work in your home work office. We can even set up an iPad for someone if there is an app that you saw on here that you wanted to try out. And you don't have a smartphone, or if you do have a smartphone and you want to try it out before you download it, you can definitely give us a call, and we can work with you on putting some apps on an iPad for you to try as well.
Okay, is there anything else, Sal, before we wrap up? Do you want to show the virtual tour of our assistive technology labs?
Yeah, I would just like to, as we finish, just really encourage everyone who's listening right now to write down the name of one person they think could benefit from assistive technology, someone that they know. It might be someone in their family, someone they work with, because I think it's really important to people. I think a lot of people with disabilities and a lot of older adults and their families can get into a helpless state about things sometimes. And there is a lot of different things we can do to help people. And I would really encourage you to think about those folks, write them down, tell them to call us or to call your local Assistive Technology Act program. Thank you all so much for being here today.
And before you press play, Tori, I see that someone just said the QR code is not working for that survey link. So thank you
Yes,
for letting us know. We will
yes.
definitely look into that.
I will look into that. I'm actually typing right now, and I'll make sure that that we have the updated link for you.
Yeah, try the URL code.
Okay, so we are ready for our video. Is that correct?
Yes.
Okay.
So this is just a little visit to our lab. And you'll
All
get
right.
to see, you'll get to see Tori in person.
All right. Can you see my screen? Can you see the YouTube video?
No.
Yeah, I can see your screen.
Okay.
Tools for Life is Georgia's Assistive Technology Act program. Hello, my name is Tori Hughes and I'm the Outreach Specialist for Tools for Life. Welcome to the virtual tour of our Assistive Technology Solutions labs here at Tools for Life. We're so glad to have you with us today. Tools for Life is Georgia's Assistive Technology Act program. We offer a variety of solutions that include device demonstrations, assistive technology device loans, funding resources, assistive technology training, and outreach support. We have created this virtual tour of our assistive technology labs as a way for everyone to grab a quick peek at some of the AT items we have in our labs to help people with disabilities live independent, purpose-filled lives. The labs are divided into 3 areas. We have the AT Solutions Lab, Environmental Access Lab, and the Augmentative Alternative Communication Lab. So let's start the tour with our first stop in our AT Solutions Lab. This area offers a variety of AT solutions in many areas. We have solutions for the home and community, as well as school and workplace. This section offers solutions for preparing meals and eating. We have automatic feeders that we can demonstrate. Along with eating, we have other solutions to help with everyday self-care. This includes bathing, toileting, and hygiene. We also have assistive technology to help those who may be blind or have low vision. These include video magnifiers, talking graphing calculators, and refreshable braille displays. We have solutions for hearing that can assist in a classroom or work environment, as well as listening to your TV at home. In our AT Solutions Lab, we have items that you can wear that can assist in making dressing easier and reducing anxiety, such as weighted vests. Our next stop on our virtual tour is our Environmental Access Lab. Here, you'll find solutions to help in controlling your environment. Next, we're going to move on to our Augmented and Alternative Communication, or AAC Lab. This is the newest addition to the Tools for Life AT Labs, and we are excited and thrilled to demonstrate and show individuals all sorts of different solutions when it comes to communication. Of course, this is just a sneak peek of what we have in our inventory, and we hope that you'll reach out to us if you want to see more. If you need help solving a problem for yourself, a loved one, a student, an employee, or anyone else, please feel free to get in touch. If you would like to schedule a time to demonstrate an item, please give us a call at 1-800-497-8665 or check out our website at www.gatfl.gotech.edu.
Thank you, Tori, for showing that. And someone has asked if we could email the YouTube video link.
Absolutely, we can email that out. Not a problem at all.
And I also see another comment that the URL is not working. So we'll have to
Oh,
figure
good.
out what's going on there.
Yes, we will definitely figure that out and let folks know.
Oh.
But I think that pretty much wraps everything up. We do have a post webinar evaluation that we would very much appreciate your feedback on. You just go to this URL here in the on the screen. I'm actually going to put it in the chat as well. That way you guys can go right to it. And I know this link works. I did test it out. So, but this just to let us know how we can improve and how you, what kind of information you took from this webinar, and if there's anything else that we can take into consideration for future webinars. Regarding any continuing education credits or CRCs, I will be sending out information regarding that within the next 2 to 3 weeks, just to ensure that we have everything set up. But if you have any other questions, please let us know. And I will be sending out the PowerPoint presentation to participants before the end of the week, so before the end of the day tomorrow. And I will include those links for the video, as well as, an updated link for our health literacy survey. If there are no other questions or comments, I will have us sign off here. And if you have any other questions or comments, like I said, please let us know by taking our survey that's in the chat right now. So thank you, everyone.
Thank you.
Thank you all, and